Hello and welcome to our Friday webinar. I'm not sure if you guys can see who we really are, but we're wearing disguises to start this thing
Well,
off.
I mean, we're wearing the seasonal attire. Is what we're wearing. Uh, a pirate if I've ever seen one.
Right, and I have a little
And
bird.
a bird. Yes,
Not a
yes.
parrot, but it's a bird.
It's that time of lovely time of year, and it's Halloween, and I hope that
Right.
our attendees are looking forward to a fantastic night with the ghosts and the goblins, and have a lot of treats for those who ask. If they
There you
don't
go.
ask, if they don't say trick or treat, then give them a trick. And the
So
trick is no candy.
no candy. And so I'm going to take a guess that you don't wear that when you go in to see your clients, like your birds.
No, I don't. Only reptile patients I wear
Only
that.
reptile patients are like, hey, I like you now.
Yes.
That
Yeah.
would make a bird if you needed
Yeah.
to wake them up
No,
suddenly, I guess, and startle them.
not my little avian patients or big avian patients. If it's the ostrich to the hummingbird, I see them all.
There you go. I guess that's a reminder. Maybe if you are going to costume this Halloween, just to be aware of what you look like to your bird. Just
Oh yes. You want to, and it's a kind of, it can be a kind of a stressful night for those little birds that don't realize that it is Halloween or trick or treat. So keep that in mind.
all right, all right. So I didn't even. So for those who are just joining us, we're doing another great episode of Ask the Vet with Dr. Tom Tully. That is Dr. Tully. I can vouch for that under that scary mask.
Well, we could only hope.
Or there we go.
Yes.
But I should have dressed as a vet today, but then I wouldn't answer any questions appropriately.
Yeah, that's right. That's right. What can I say?
All right, and just I mean, just I'm gonna go a little tip here that mine is actually not a physical costume. It's just I chose my virtual background. So yeah, you can do anything you want. See, I could yeah. Anyways, so now I know how to get it off. I'm gonna be a pirate this whole time, I guess.
Now that raven mask you were wearing is not virtual.
No, that was an actual, maybe I'll put it on towards the end, but it will scare people. And I'm hat. Okay, sorry. I'm just doing all sorts of things. All right, guys. So if you're just joining us, you're for another great episode of Ask the Vet. And yeah, and let us know where you're tuning in from, because I love to see where everyone is joining us. And okay, so if you have a question for Dr. Tully, use the Q&A feature and not the chat feature, so that we can get to the question easier. And yeah.
Yes, and we always have very good questions. And I think that the last session, we had a number of questions that we really had never touched upon. And all of the questions are good. And often, even if we have touched on some of the questions, that the new questions that come up are a little bit different, and have a different effect, kind of can remind me of different cases that may have treated.
There we go. All right. Let's see here. Let's see what questions we have. Oh, we have people from all over. And okay. Well, I think we covered so pumpkin is that we're coming into the pumpkin season of the year. I'm just going to throw that out there. Can birds eat all the pumpkin? Like, can they eat the seeds? Can they eat the flesh? Can they eat the outside? What parts of the pumpkin can a bird nibble on?
Well, I think that's an excellent question. Again, I believe, I don't know of any part of the pumpkin. It's kind of an edible gourd, if you will, and the pumpkin seeds, of course, you'll see many of the commercial seed mixtures have pumpkin seeds in them. And so the pumpkin seeds, of course, they could eat. And the outer rind is probably something that would be very, again, for the GI tract, I don't think that it's going to have much nutritional value, and again, it would be somewhat difficult to digest. So it's the I guess the meat of the pumpkin, if you will. Again, that would be something that obviously you can cook that for pies, for instance. With spices, it's the one thing, just the raw pumpkin.
Yeah.
If you look at that, I don't know how tasty a raw pumpkin would be. Not that I've ever, eaten raw pumpkin. And maybe in this mask, I have a tendency to, that's appealing to me, raw pumpkin. But I just think that what makes pumpkin pie so good are the spices that you put in it. And don't recommend a lot of spices for the birds. I don't think a little bit's going to hurt them. But for the most part, if they just ate the raw pumpkin, or if you pureed it or what have you, that it wouldn't be, that would be okay. But I don't know how much real nutritional value you were going to be able to get from that.
Okay.
So that's kind of a synopsis on the pumpkin. Yeah.
Okay. All right. There you go. Okay. 10-year-old Pioneus has balance issues. Doesn't fall off the perch, but when she moves fast, she can lose balance. Then stretch the wings. And that kind of led to multiple broken blood feathers recently. She doesn't limp. She eats well, has energy. She's ABV positive, but tested negative for avian ganglionitis, PD twice. PDD.
Wait, say that again. I
Did I
mean,
say it right?
the AB, whatever.
So she's ABV positive, but tested negative for avian ganglionitis / PDD twice. What can cause her to worse? What can cause make her balance worse? And what should she be tested for?
Well, the first thing is that I'm as far as those tests are concerned, I really, as far as those results, you could test for that, and avian bornovirus. Avian bornovirus, that's somewhat of the first test that people think about if there's some type of a neurologic issue affecting a bird. My personal opinion, which of course it's asked this vet, is that that's kind of a rare occurrence that we see. I can't tell you that we've had a bird that's come through here. We see a lot of birds, but every place is a little bit different. There's birds that see, we usually diagnose on average maybe 1 or 2 birds a year with PDD. That's on average. Some years none, some years a little more, but it's not a common presentation. What's even less common is the fact that you have a neurologic case, and it would be ruled to the point where you have PDD, or bornovirus, where it's bornovirus, it's just causing neurologic signs, and there's nothing else wrong with the bird. The thing with neurologic disease, and you're talking, and that's what it is, I can tell you, it's almost as difficult to diagnose as behavior issues. It's more, of course, it's relatively easy to diagnose an infectious disease. If that's causing a problem, it's easy to diagnose once it presents itself, and sometimes it's a little bit more difficult early in the disease process to diagnose cancer. But once it is it's there and causing significant clinical signs, it's often easier to diagnose that. But with neurologic issues and with behavior issues, those are the really challenges that any veterinarian faces, doctor faces. That's the same with humans too. And so when you're looking at this Pyonis, it says it's a 10-year-old Pyonis, about a 10-year-old Pyonis.
Yep, 10 years old. Yeah.
Pyonis with balance issues, with what have you. What you want to make sure is that in overall that the bird is healthy, and that there's nothing that is indicated going on inside the bird over and above this Bornavirus test. What I'm looking at is, and we talk about it, is the complete blood count and the chemistry panel to see if everything in the bird is normal. Okay. And then, so we look for that. We look and see if it's in good body condition. And then we also look at the eyes, because the eyes, of course, can affect balance if the bird has difficulty seeing. So that could affect balance. Nutrition many times is correlated, not all the time, but it's correlated to what the blood tests that I mentioned, if they would be normal or not. And so that's important, because if you have nutritional imbalance, if you have nutritional deficiencies, that could cause balance issues. And so you look at in Pyonis, and I know I've seen Pyonis before with high cholesterol, triglyceride levels, that you could, and is this progressive, or is this something that all of a sudden started happening, where the bird was fine and then all of a sudden, boom, balance issues. We are lucky here to have a neurologist to do an exam on the bird, and try to determine possibly where the problem is, and the significance of the problem itself. And so when you're looking at this 10-year-old Pyonis, when did the problems start? And what you're looking at, is there a bit of progression of the bird's ability to balance or not? And that's all what you're kind of starting with. And with this, and if you do have progression, what has it progressed from to what it is now? And but in general, the Bornavirus, again, what can it do? And that's always a wild card for me. And again, like I said, we have the ability to, at the veterinary school here, to have board certified pathologists look over cases in which the owners are willing to have the birds necropsied or autopsied. So we try, when we are not sure of a diagnosis, or it's unknown, or the bird dies shortly before it comes here, or once it gets here, it's in very poor shape, condition, that we can get this autopsy or necropsy. And so in unusual cases, as I said, neurologic cases, things of this nature, we have the ability to get full necropsies where they examine the brain, they examine things. So it's not like, and so they're not going like, well, Dr. Tully, here's another one of those cases of avian bornavirus that just are neurologic and nothing else is wrong with it, and you missed it. I'm not getting that, you see. And so again, I would kind of look at some of the things that I mentioned, and hopefully that may have been the case where you have had this blood work done and you've gone over your nutrition, you've kind of gone through the problems with your veterinarian, and trying to figure it out. And it just depends on how far you go. And like I said, in some of these cases, and it gets down to, if you bring in a bird to a veterinarian, it's like, what I want to do is oh gosh, thank you, Laura, for bringing in the bird today. Oh, it has a little infection that's going to be resolved with this antibiotic. And I've seen it many times, and you're good to go. That's what I want. Boom, boom. But if it's something that it may be something like, well, it's not responding. Now we got to do blood tests. It's not responding to, it may be cancer that's causing this wound not to heal. We're going to have to take a biopsy. Oh, well, gosh, it may be involved with the bone. Now we have to, do a radiograph. And so the more complicated the cases are, the more that the initial diagnosis isn't definitive, then you have to go down the testing protocol to try to help identify what that disease condition is. Sometimes it's difficult. Sometimes it's difficult where everything's negative or normal, and you have this problem that continues to go on. And guess what? Sometimes it just takes time for that disease to develop. It just doesn't, the body is not responding where you can see it. So, and with these neurologic signs, as I mentioned, there may be, you get to the point where you need to do a CT, a CAT scan, just to see if there may be something within the brain that may be causing this. And then again, it may be something like atherosclerosis in this little Pyonis. We've seen high cholesterol triglycerides in Pyonis that may cause stroke-like tendencies that may affect the balance of the bird. So as you can see, it's a great question, but not one that's easy to answer, because it's a neurologic case, and I feel for the owner of this little Pyonis, but the main thing is that it's a step-by-step basis until there's something that can be identified. And all of those things that I've mentioned, kind of a long answer, but it's that type of problem. It's just like a behavior problem. When you have we have a bird with feather destructive behavior coming in, you're going to spend a lot of time going over history. So that's what I would look at. I wouldn't, It's possible. It's medicine. It's possible. It could be avian virus. But again, I wouldn't at this point put it high on the list. I would be looking at some other issues. If it is avian, well, I think it's avian virus causing it. Well, what you're looking at is something that may be helpful, is putting it on some type of anti-inflammatory medication to see if you get any type of benefit from that. Celebrex is one thing that they do with avian viruses, and then rabinocoxib or Onsior is another one that's given once every 3 days, administered, that can be given to just see if you get a treatment response with that. But again, and there's minimal side effects that's been associated with the use of those treatments. So there you go.
Okay. That was thorough. You're right. You got a question about where do labs get their reference ranges?
Where do labs get their reference ranges? Well, that again is a good question. Labs, and I'm just going to kind of give you some different, I guess, possibilities, because sometimes that the labs get their reference ranges from they determine their own reference ranges. Sometimes they'll utilize through the sampling that they do, or testing that they do with, if it's a big lab. Others use reputable published reference ranges that are out there, and so that's pretty much where they would get the reference ranges. I'm not aware if you were an accredited lab, if there's a reference range for accredited labs. The one thing that's in general you could pretty much count on is that the reference ranges for the most common bird species that people have, say the 10 to 15 parrot species that the majority of people have, are fairly, you could pretty much count on those being reputable with those. The problem is when you get into some of these more unusual species, I say unusual because it's just they're not kept as much as African grays or cockatiels or budgies, or chickens, something like in your lorries, some of your more rare cockatoos, that those are, there's some published information on that, but often there may be a species where you don't have published information. And what I'll say is that in general, with most parrot species, and in general most birds, that the reference ranges don't change that much in my mind as it relates to what's normal and where a diseased animal is, where there's disease condition that's affecting that say blood work. And so it doesn't, it doesn't really, I don't really see it, I don't see a palm cockatoo coming in and going like, oh my goodness gracious, we don't have a reference range for it. There are reference ranges for that are published at different things, but I'm not sure how that lab may select that or where they may get it, but they may get it from that published source. They may utilize that. But like I said, they may do it themselves or they may get it from a published source that would be considered peer reviewed and scientifically valid in that manner. Yeah.
Okay. This is an interesting question that I don't know if we've had this one before. So this is a 1-year-old male society finch with feather loss. So they moved him into his own cage and his feathers do not seem to be growing back. So they believe maybe he's removing them himself. The feather loss is on the body and not his head. So what are some causes for feather loss in a finch, and what diagnostics could be safely done, or treatments?
Well, the diagnostics that can be performed are few and far between. The thing that could be causing the feather loss on a finch, if it's his body and not the head, is again similar to what you would see in a in a parrot with feather destructive behavior. Now, I'm one to say, they want to say, well, it's not feather picking, it's feather destructive behavior. And so I'm one to say, well, and I've said it before on the Ask a Vet, I've said there's feather destructive behavior and there's feather picking. Okay. That's when a bird pulls the feather out and it looks like a Thanksgiving turkey from the neck down, that's feather picking to me. I don't know what else you call it. It's not destroying the feathers, it's removing the feathers, the feather removal behavior. I don't know. We can term that today. That's the new term, feather removal behavior. And so feather destructive behavior, and it's very evident, is when they just kind of destroy and pick and just destroy the feather architecture. They look just like a ragged bird. Yeah, that's feather destructive behavior. But the feather removal, and so I'm kind of getting the idea that the feather removal on this bird, but if it is feather destructive behavior, then it could be stress. And you're going, well, I removed it from the other cage, and it's still doing that. If it is removing the feathers, they should grow back. If they don't grow back, if it's destructive behavior where it's they look disheveled and they just look ragged, well, that's not gonna change until the bird actually molts. Those feathers will stay in raggedy until the bird molts. But if they're not there and he's picking them out, then they should grow back. If they aren't and he continues to remove it, it could be again, like I said, stress or nutrition. And then you go, well, it's getting the same diet that all of my other finches are getting and they're fine, and so that would kind of rule out the nutritional aspect. Although each individual bird is just different, like each human. You're your own special person and you're a little bit different than everybody else, and your body has different requirements, a little bit different than everybody else. On the most part, it's the same, but maybe just a little bit, and enough in a finch to result in this. And so that's kind of what we're looking at now. Now, of course, it could be something that is infectious. You could have a folliculitis, something that's affecting the feather follicle, bacterial infections, something of this, something like that. If they're falling out or what have you, and that would have to be looked at closely. And as I said, there's not much you can do with a 20-gram bird. Now, 15 to 20 grams, it may be a bigger finch, it may be closer to 25, but I mean, you're only looking at being able to collect about 1/10 of a mil, or maybe 0.2 mils of blood. So there's not much you can do, but you could look to see how significant the inflammation is. There's inflammation if it is pulling out the feathers. But in general, as I mentioned, just because it's a finch, it doesn't make it any different than what could cause some of the feather problems that you're seeing. Now, naturally, if it's in with other birds, as you mentioned, they could be pulling out the feathers, and that usually occurs on the head. That's usually around the head of finches and passerines, where the other birds are picking out the feathers and pecking at its head. Boop, boop, boop. Yeah. So, yeah.
Okay. All right. Poor little finch. So we've got a question about, well, first it says, hi, Dr. Tully, or Tyler, Vance, and Buffett here. So Louisiana. It's a little shout out to you.
Well, fantastic.
So the question is,
Hoosers.
there you go. Yeah. Are any nuts, walnuts, for example, healthy for parrots in small amounts? And like, are 6 or 7 pistachios and Brazil nuts and almonds okay per day?
Well, it just depends, on that. I think that adding all of those up, it's probably getting into probably an overindulgence of those nuts. Again, we know Brazil nuts don't have any B12 in them, but it's probably getting it from other sources. But and the high, I would just say that it just seems like adding 6 or 7 pistachios, Brazil nuts, and all of those that were mentioned, that equals a large amount. And so the one thing is that I think that would be 6 or 7 of those, well, variety of those wouldn't be that bad, but 6 or 7 of each a day would be. I think that should be would be reduced, because I can pretty much tell you I would go for those nuts. I mean, that's the first thing that I would eat, and over and above anything else. And so that's going to be filling if you combine all of those together. But if it's just 6 or 7 of a variety of those, I wouldn't think it's too much. And the walnuts, as far as I wouldn't call it a healthy, I guess, food item, but I wouldn't. There's nothing wrong with feeding that, as it would be with the Brazil nut or the pistachio or what have you. It's the same thing as like a pecan. Here, you have pecan pie, but we have pecans all over here. And so you can go in your backyard and there's a pecan tree and you got hundreds of pecans, and they're great. But you don't want to feed that. And I know that we used to have a free flying macaw that would stay in the pecan tree where I lived, and where I live now. And it was a green wing, and I don't blame it. But it's, it's just like you'd go to a chocolate factory and eat chocolate all day, or, so whatever, so yeah. in and of itself, those aren't bad, but it's just, in moderation, as part of a diversified diet.
Okay. Yeah, like maybe not give them like 7 Brazil nuts. Those are
Yeah.
the big ones, right?
Yeah, exactly. That's what I'm saying. There's 7 Brazil nuts, 7 pistachios, 7 almonds, 7,
That's right. Okay. All right. So, question about from Anne. My friend has a 4-year-old budgie, female, who has never bred. She splayed legs as a baby. She had splayed legs as a baby, which she overcame with the help of her vet. She now looks like she has splayed legs again. Does this happen? Is this normal? And should we look for another reason? So it was hatched with splayed legs, and now or as a baby, it had splayed, and now it's back to having splayed legs. So.
And what kind of bird is it?
It's a budgie, a female budgie who's 4 years old.
Huh. Interesting. No, usually if the birds have splay legs, and you make a diagnosis of that, and it's treated early. And the one thing that I always with splay legs and anything that has to do with leg and developmental issues, you have like we had an Indian ringneck that came in this week where about half an inch of its beak was removed somehow. Okay, and so it's all about expectations. And when splay legs or beak, even the removal of the whole upper beak, it's gone.
Mhm.
Got to know what the expectations are. And the one thing with legs is that they're never going to be perfect. They're never going to be perfect. If they are, that's what the expectation is. What we are looking for, what I'm looking for, and that's what I always want to make sure that the owner understands, is that I'm looking for quality of life, where that bird will be happy and that bird can get around as much as we believe it can. And that it'll have a good quality of life. And there is a wide range from very close to what's normal to you have to provide platforms for the bird or ropes for it to get around, but the bird's still doing well. It's still getting around. It has a quality of life. So whenever somebody comes in with a leg problem, the first thing that I want to do is make sure that there's an understanding of what those expectations are. Just like with a beak, if that upper beak's removed, or if there's a part of that beak is removed that's of any significance, like that Indian ringneck, it's not going to regrow. It's not going to regrow. It'll just heal over and it'll be blunt. Or if it's near the frontal bone, it's going to be beakless. The upper beak won't be there, and you're going to have to just trim that lower beak as it grows, because there's not normal occlusion there to wear it down. So with this, the little budgie, it appears that that things worked out well, and for whatever reason, that this budgie's legs have started to splay again. And usually when legs are splayed, we'll put them together. And of course, this is always it can be a challenge. If everything is in normal position and they're splayed, you can put them together and they'll stay there. But sometimes what happens is that if there is some abnormal development due to the length of time that those legs are out and the body and the bird's young and they start growing, you can put the legs together and then the knees go out.
Oh,
See, so you put the legs are out here, you put them together, and the knees are out now. So you have to put the knees together, and you have to then put the bird in a frame, kind of a brace, if you will, and so that the legs remain there. And in no stretch of the imagination are those legs going to come out perfect. But you can get the bird to perching and adapt to its developmental issue due to that problem. And so it's kind of interesting with a splayed leg budgie that you got to perch normally, that all of a sudden, because when the bird is perching, it usually maintains those legs in a normal position. What happens with young birds is that they may be on a slick surface, and their legs, they can't get them out and get them under them, where the parents are throwing out the nest box material, and they're just on slick plywood or metal or what have you, and they get splay leg like that. So so what we want them to do is perch, because when they perch at a normal position. So I'm not sure exactly what has caused the little budgie. I want to give everybody a background on this, because one, if you do have a bird with splay leg, you need to, and expectations, don't expect it to be normal again, okay, because you're overcoming a problem, okay. Secondly is that once you get the bird perching, usually the bird maintains that positioning of their legs for the rest of their life. Now I'm not sure, exactly what the environment is on the little bird, or what may have caused it to kind of revert here. But that's something that needs to kind of be investigated. And it says it's a little female budgie, I think it is.
Yeah.
But it's did it say anything about laying eggs or anything like that?
No, although it's 4 years old.
Yeah, and then but it may or may not be. The other thing is that is it kind of equal? Is it the same thing as it was at the beginning? That's something to consider. Or is it splay leg? Is it just not using one of those legs? There could be some kind of delayed nerve issue that resulted from the splay leg, which would be uncommon. But that is one possibility. Another possibility is a tumor with an impingement. And then, of course, and when I say an impingement, what I mean by that is that it's not uncommon for budgies, especially older budgies, but it does, 4 years old is, a fully grown budgie, mature budgie, to have tumors, gonadal tumors, or kidney tumors that actually impinge or put pressure on the nerve of the leg, one of the legs, and they have difficulty using it. That's not an uncommon presentation for budgies. So that is a possibility. It's somewhat difficult to diagnose, It's not a lot of times those little budgies, the tumors or don't really show up well on radiographs. We just did a micro CT, which is kind of a mini CT for small birds, and on a budgie that had unilateral leg lameness. And so that means only one leg was affected. And that's usually the presentation. So when you say display legs, is it kind of just like before, or is it, one of the legs affected more than the other? And that's causing, because they aren't normal, that it's causing a pronounced splaying of the leg, because it needs both legs to really function. So that could be part of the issue, that it's not both legs really, it's just only one leg, but the other leg is, because it's not really normal, it doesn't have enough to support it. So it looks like it's splay out again.
Okay.
So those are all considerations. Yeah.
All right. So we have a question, female. Okay. So this person's been caring for this female Congo gray for 4 months, and sadly the owner passed away unexpectedly. So they jumped in, which is great for them to do.
Yes,
So
we've had a couple of cases like that's come through within the last few weeks.
oh wow. Okay. So they don't know much about the bird's history, but they did get a hold of the vet record from 2015. And the record says at that time that the gray, she's 45 years old and had a seizure during the visit. So this is going back to 2015. It says since they've had her, she has been having cluster seizures once a month, consistently almost to the day. So the recent exam and blood work revealed nothing abnormal, although she had a massive seizure during the exam. Gram stain was normal, white count normal, calcium levels normal, no toxicity, no anemia, no cancer. The vet prescribed gabapentin. Should they keep her on it? Would she have to stay on it indefinitely? So we got a older gray with some seizures going on here.
Yeah. Well, one of the first things that I would be kind of concerned with, and it seems like you have a good veterinarian there taking care of the bird, but you basically have 100-year-old bird, in human terms, and so you have a very old African gray. You think of what's a very common geriatric disease condition in parrots and also in humans, especially males, and that's cardiovascular disease. And the cardiovascular disease, it doesn't, the term cardiovascular really doesn't really denote the extent in certain areas of the body. You say, oh, cardiovascular, so it's heart vessels, what have you, atherosclerosis, and we've mentioned that. Now, looking at that is, and again, like I said, you have excellent veterinarians taking a look inside the bird and everything for a 100-year-old bird. Well, it's what it was 45 5 years ago. It's 50
45 in 2015. So we're talking.
Well, I want to say 5 years ago, but man, it's almost like 10 years ago, right?
Yeah.
So it's 55 years old. Like it's 100. Oh, we just had a lady that was kind of a runner and an Olympian. She just passed away in Baton Rouge, 108 years old. So we have a 108-year-old African gray here, if that's the true age of this African gray. And that's possible because there's a 108-year-old woman. How many 108-year-old people are out there? So the one thing is that you can almost bet that this bird has atherosclerosis. That's just like you look at any 80-year-old male, human, and you can pretty much bet that they have some degree of atherosclerosis. So that would be primarily what I would say is would be one of my top differentials as why the bird is having the seizures. And the seizure would be associated with stroke, where, and that's what I said, cardiovascular disease. Well, vascular means the whole body, and including the vessels in the brain. And sometimes if the vessels in the brain are occluded and the brain tissue doesn't get oxygen and blood supply due to occlusion, that causes a stroke. Okay. And it may not, and the birds are, that we see that have these at this point, it's not like well, it's left side or right side where you have an inability to use that the function, motor function on that side. What we have, what's not uncommon is the seizure activity, somewhat like you described, where especially if you increase the blood pressure, right? When does this, it happens. It doesn't have to happen when the bird's being examined, but when the bird is examined, it happens, right? And so that's an increase of blood pressure, stress, right? And so, what the so you say, well, what do we treat it with? Well, unfortunately, there's nothing, if it's related to a stroke, which to me it would not be out of the question, and that would be a highly likely concern, is that just to treat the bird with medication to reduce the chances. Keppra is a drug that is used, and that has been we've found, and we've used it on African greys that we had that have had seizures associated with stroke. And Dr. Beaufrere, he's at the University of California, Davis now, was working with a bird when he was here, that actually published a paper that was where we used the Keppra, and that was effective in reducing that seizure activity. The problem is that you have to treat it on a daily basis, just because to prevent the seizure activity. But once the stroke happens, it causes pathology within the brain, or brain damage, because it doesn't have that blood flow, and then so the bird really, it doesn't really ever fully recover with that. So that would be the gabapentin is not going to hurt the little bird, little African gray, but it's not going to stop the seizure activity. And the seizure and what's causing the seizure activity, in my mind, isn't treatable. Okay, you just have to treat the seizures. And we had little African gray here that we diagnosed with the stroke through an MRI, and the one I'm talking about that Dr. Beaufrere had, and the problem is that if you wait 2 or 3 days after that occurred, you're not going to be able to pick it up on an MRI. So and really, I don't necessarily recommend that, because the procedure's so long. It's such a cold room. It's kind of difficult on the bird. An MRI is necessary if you need it, but in this case, it's not going to be helpful if you're having these seizure activities for this period of time, to try to determine, well, is it a stroke or not? Because the tissue is going to look normal. You have to do it within 24 to 72 hours at the longest, to try to pick up the abnormal images of the brain. But nonetheless, it's occurred in my mind, and you have that's the most likely things. It could have been trauma or something else that caused some type of a brain injury. That's not treatable, but you know, the bird can live, and we had that little bird live with the stroke for years on that medication, and you know, we had to modify it. You know, it did well, and if it had more, we'd increase, and it, you know, but that really, the Keppra is a good drug to use to prevent seizures. So, excellent question.
Yeah. Let's see if we have. Well, I got announced today's winner. Let's see if we, I don't know if we
We're
have.
not there yet.
I know we are. Sorry, and I
We
need to
just started.
I feel like we just did. You stayed true to character this entire time. I'm gonna love this recording because you're gonna be in a mask. Hang on.
Well, this is it. Every Halloween.
I know. I'm gonna have. Okay. Yeah, I'm gonna have to join you here. Let me get back on my pirate here. So. Okay, there we go. Back
Yeah, there you go. There you go.
So we have our giveaway winner. That's the pumpkin spice Nutriberries, which are a limited time. They're only until November. So get yours now if you haven't gotten them yet. But that's gonna go out
There
to
you go. Okay.
Susie Anders. Congratulations, Susie. You're also gonna get another Lafeber product of your bird's choice. So congrats on that.
Yes.
Yes. So we had some the Finch one. That one kind of haven't heard that one before. I mean, the Finch and the Feathers, that one stood out to me especially.
Yeah. And like I said, and like the, you know, like the you know, the owner, the questioner said, well, what tests can you run on a Finch? Well, there are some tests, but you have to be very specific. And on those tests, but that's the challenge that we face as avian veterinarians. What we can do, and as far as treatment on a very sick or a bird that is in very critical condition, what can we do and what should we do to try to get that bird and give that little bird a chance to recover? That's the question. You know, it's like you just don't dive in like, whoa, let me get it, let me do some, you know, and then well, you're not going to have it. You know, the bird's not going to survive that. You have to be very, very careful and with that, and you have to do it very precise and be very specific, and work with the patient. You work with the patient. You don't just work on the patient. You work with the patient to have it recover. Yeah,
I feel like you should be like dressed as Sherlock Holmes when you, you know. That's your Halloween costume right there. Is you have to find you gotta get to the bottom of everything when a patient comes.
Yeah, well, I mean, you know,
kind of what you are, right?
The more you learn, the more you don't know. That's the thing, you know. It's just a never ending learning process. I tell you, and I tell you what helps is the bird owners that I've been associated with, and that I've treated their birds and conversed with, and are friends of mine, very good friends of mine, and have been. They have been very helpful in my learning process, you know, over the years, and for that I am infinitely grateful for that. But it's onward, Laura, to learn more. And like I said, we've come a long way since 1980 in the late 70s, and but we have a long way to go. But
Wow. Yeah.
it's good. It's
Yeah.
good. We're going.
Yeah.
We're going in the right direction, in the correct direction. So yeah.
That's true. Wow. Yeah. Keep moving forward. And yeah. Okay. So I guess that was the end of our. It went by quick.
Yes,
And,
our
yeah,
Halloween edition of Ask
right.
the Vet.
We're gonna go like, what is going on? Yeah. Well, I hope. Yeah. If, I'm just gonna imagine you wearing that the rest of the day. So there.
Yeah, I just save it for the special attendees of this webinar.
Or when you teach your class, just there.
Yeah.
All right. Okay, so I'm just a sneak preview for next. Gosh, are we heading into November already? It'll be there sooner than later. We'll be on next November. I think it's the Friday, November 1st with Dr. Lamb. She's going to do California condor care in the wake of avian flu. So that'll be an interest. What you got there?
This is supposed to kind of light up, but it doesn't.
Oh, there you go. You're showing me the time. Hey, it did light up. All right. It's always a pleasure, Dr. Tully. Thank you. Thank you for joining us. All right, guys. On that note, I hope everyone has a great weekend. All the best to you and your flock. Stay safe. Until next time.
All right. Thank you. Thank you, everybody. Excellent. Thank you, Lauren, Brenda. Yes, and Lafeber.
Yes. All right, guys.
All right. Bye-bye.
Bye.